Hello, it's Dr. Garrett Pullman, host of the Prostate Health Podcast. I am very excited to have Dr. Elizabeth Wulff-Burchfield from the University of Kansas Medical Center joining us for a second episode. She just recently did an excellent job in breaking down advanced prostate cancer. And today, we'll be discussing palliative care and how it's valuable for both men and their caregivers as they navigate a complex prostate cancer journey. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. Joining us today on the Prostate Health Podcast is medical oncologist Dr. Wulff-Burchfield. She attended medical school at Duke University. She then went on to complete her internal medicine residency and fellowships in both medical oncology and palliative medicine at Vanderbilt University Medical Center. She is an assistant professor at the University of Kansas Medical Center, and her specialties include genitourinary oncology and palliative medicine. Her clinical research is focused around genitourinary cancers as well as the intersection of genitourinary cancers with supportive and palliative care. Dr. Wulff-Burchfield, welcome to the podcast.
Thank you.
So can you tell our listeners, first of all, what is palliative care?
Palliative care is a form of medical care largely focused on quality of life, and it's really available to anyone who is dealing with a serious illness. And the goals of palliative care are largely just to help remove any barriers to people living their best life, if that's symptoms or communication needs, to help support people when they're facing medical decision making, and to help support their entire caregiving team, whoever that would be, if it's family members, loved ones, friends, children, etc.
So you certainly bring multiple perspectives to the table, having board certification in both medical oncology and palliative care medicine. Can you talk to our listeners a bit about how each of these two roles may differ while both still bringing value to the patient experience?
Yes, absolutely. I certainly wear two hats and couldn't practice one without the other. So I love both of these fields. Medical oncology is largely focused on the treatment of cancer, as well as the other impacts that cancer has on patients and their families, like managing pain and symptoms. But there is much more of a treatment focus against the cancer specifically. So in my oncology practice, that could be hormone manipulation, chemotherapy, targeted treatments, etc. Palliative care, however, really just focuses in more on quality of life and doesn't focus a great deal on the treatments themselves. Palliative care physicians are almost never medical oncologists as well. And so it wouldn't be appropriate for me as a palliative care provider to be prescribing treatment for cancer, generally speaking, and the same is true for my colleagues. So it really is just, with palliative care, we just really sit with that person, focus in on who they are, what drives them, what a good life looks like to them, and how we can make it a reality.
So how's palliative care different than hospice?
Great question. I think most people in America, including probably most physicians, really need this defined. So that's a really important question to define. I think of palliative care and hospice as being on a spectrum. As I said, palliative care is really focused on quality of life for anyone dealing with a serious illness. You'll note I didn't say a terminal illness or a life-threatening illness, but it really can be for anyone going through something difficult medically, whether that's even receiving treatment with curative intent, like a bone marrow transplant or aggressive cancer-related treatment, or a solid organ transplant for that matter. With regard to cancer, we always say it's for any age, any stage. Hospice is essentially a form of palliative care that's really holistic and becomes the patient's medical home. So for people who have a limited life expectancy, which is defined as 6 months or less, and who aren't going to be pursuing aggressive medical care that's focused on life prolongation, hospice is both a philosophy of care and a set of resources to help give them everything they need from the medical system, including nurse, social worker, chaplain, and sometimes physician or advanced practice provider visits at home, support for their family members, any equipment or medicines they need, and then ultimately support for their loved ones after they're gone with bereavement support for more than a year after our patient passes away.
So how might someone initiate care with a palliative care specialist if interested? Because it seems like there's a lot of benefits that come with this.
So usually patients in our outpatient palliative care program have been referred by their oncologist. However, that's not required. Patients can self-refer, and increasingly we're seeing referrals from other types of healthcare professionals like primary care or their surgical or urologic oncology team, radiation oncology, etc. So generally, I think the easiest way to start would be to ask your medical team, either primary care or medical oncology or urologic oncology team for a referral. I will warn you, because there are still a lot of misconceptions about palliative care, it could be that you could get the response, oh, I don't think we're ready for that yet. But I think what I would advise would just be to say, yeah, I'm not changing my mind about the care that we're doing. I just want an extra layer of support.
Certainly. So do you find or see some challenges or find it difficult at times for individuals to have access to a palliative care specialist, particularly those in underserved or more rural areas?
Sadly, yes. That is a huge concern for the AHPM, which is the American Association of Hospice and Palliative Medicine. That's a huge concern, although thankfully, I think that the one silver lining out of a lot of difficult things going on right now is that telemedicine is easier than ever to accomplish. And so I think that telemedicine is going to be a huge way that we bring palliative care to the masses, regardless of whether they have physical palliative care capabilities in their local area.
Thanks again for joining us today on the Prostate Health Podcast. If you're enjoying the show today, make sure you visit my podcast website at www.prostatehealthpodcast.com. There you can find show notes to all our episodes. You can also click on our resources tab, where you can find links to our trusted partners of the podcast, as well as links to books, resources, and products, all of which can help in your journey with either an enlarged prostate or prostate cancer. You can also sign up to receive my free What to Expect guide, which includes checklists of what you need to bring and how to prepare, including what to expect with 3 different scenarios, including your initial urology clinic appointment, a prostate biopsy, or prostate cancer consultation. Sign up for the free guide on the homepage of www.prostatehealthpodcast.com or access this guide directly at www.prostatehealthpodcast.com/clinic. So do you find that some patients are initially a bit hesitant or maybe even afraid to involve a palliative care specialist?
Absolutely. Because hospice care is one end of the spectrum of palliative care and is typically the only form with which patients have ever interacted, there are a lot of barriers regarding their own fear about it. Although I do find that when the referring provider reinforces the idea that, number one, they're not abandoning the patient, number two, they're not changing courses, and they just want the patient to have an extra layer of support, that endorsement makes all the difference. I still do start my visits by saying, tell me, what did Dr. So-and-so or your other provider tell you about the reason we're meeting today and what palliative care is, just so that we can get it all out in the open and see what, if anything, is going to be running through their mind that we can just address upfront.
Perfect. And you kind of walked us through a little bit about that first visit. Any other things that one might expect during that initial, consultation or visit with the palliative care specialist?
Well, in our visits, we have a measure called the Edmonton Symptom Assessment Scale, or ESAS, which is a patient-reported outcome measure that is a good symptom assessment. So many palliative care practices do something like that. But our goal in that first visit is to, number one, kind of understand the context with which our patients are approaching the visit. Number two, hear about how their life is going and what has room for improvement. And number three, just hear about whether there are any sources of distress or concern in their life so that we can focus on what they care about the most right off the bat.
So what are some of the different scenarios where you're able to assist from a palliative care standpoint in men with prostate cancer and their families, and maybe what challenges arise for these individuals and their caregivers?
Well, I think we see men across the trajectory of prostate cancer in our palliative care practice, and that could include anything from difficulty with medical decision-making regarding making choices of upfront treatment for men with localized prostate cancer, such as deciding between treatment with surgery or radiation or different radiation techniques that may be proposed. While I'm not a radiation oncologist or a surgeon, I think as long as a palliative care physician or provider understands what some of the advantages and risks are of each of the treatments, we can absolutely help with upfront medical decision making. But also we do a lot of symptom support as well. So men who have trouble with hot flashes or pain or have nausea from some of their pain medicines or from their other treatments, that is something that we assess and manage a great deal. And then also, many of our patients are facing increasingly difficult choices with regard to their medical decision making, particularly if their cancer is growing while on an initial treatment, then often their oncologist is able to present them with a number of options. This sort of embarrassment of riches, as we say, is great, but it can be overwhelming. And so we can help with medical decision making then and sometimes later if patients are considering how much interest they have in continuing cancer-directed treatment or in even discussing what hospice might look like for them in their future or arranging a simple hospice informational visit. We just kind of treat the spectrum.
So are palliative care members able to assist in both the outpatient clinic settings as well as in the hospital setting and in terms of, but also related to some of the more specific symptoms related to prostate cancer?
Yes, absolutely. I would say that any given hospital system or practice would have different team members on the inpatient side or outpatient side, or perhaps different availability of providers on the inpatient or outpatient side. At the institution where I work, we have an inpatient palliative care team as well as outpatient. Typically, there's more access to palliative care inpatient than outpatient, interestingly. But generally speaking, the goal of every practice is to have support on both sides of the care trajectory.
So who are some of the different team members on a palliative care team that an individual may expect to be working with while seeing a palliative care specialist?
Well, palliative care is blessedly a very interdisciplinary field, typically with a really flattened hierarchy. So there are certainly physicians and advanced practice providers who are involved in providing care for patients who are working with palliative care. Palliative care nurses are the world's greatest blessing. And I think that we work with much more of a partnership or team approach than even I do in my oncology practice, which is not to say that I don't have a great oncology nurse. I have a stellar, just outstanding oncology nurse, but our relationship is a little bit different in my two different practices. We also often have team members that include social workers, chaplains, child life specialists are another one that can be really important. Many of my patients, do have young men in my practice who have young children who aren't yet adult. I also have men who have grandchildren that they adore and they want help and support and having discussions with them about their disease. And so child life specialists are often someone we're trying to pull into a palliative care team to round out things.
Certainly. So in summary, really involving a palliative care team can be a very valuable option for both men and their caregivers as they navigate this complex prostate cancer journey. So Dr. Wulff-Burchfield, any final thoughts for our listeners today?
What I would love to leave you with is just to know that if you need an extra layer of support, palliative care is usually a great starting place. The wonderful thing to know is that it doesn't risk anything. It doesn't undermine what you're doing with your surgeon, with your radiation doctor, with your oncologist, or with your cardiologist for that matter. It only adds, it doesn't take anything away or put anything at risk. So what I would encourage you to keep an open mind and keep it somewhere in the back of your mind in case you need some support at some point.
Well, thank you so much for joining us today on the Prostate Health Podcast. You're certainly making a positive impact in your patients' lives, and today you've really delivered significant value for our listeners. Thank you again.
My pleasure.
Thank you again for listening to the Prostate Health Podcast. We would love to have you join our podcast Facebook group at www.facebook.com/groups/Prostate Health Podcast, or just use the Facebook group search function and search for the Prostate Health Podcast and ask to join. We'll see you at the next episode.